Welcome to United in Aging, a World AIDS Day commemoration. We are so happy that you can join us today. My name is Jadon Wright Morgan. I am the Deputy Director of the Collaborative, and we're going to get started in just a minute. We're a few more people to join, but we are really excited to have you all join us today in this important topic area. We're going to be sharing a lot of information from a lot of different programs who have been working on HIV and aging over the last 3 years. We're going to be sharing some of the best practices that we've all been working on through a grant from Gilead called Age Positively. I'm going to get started with that in just a moment. But what I'd really love you to do as we're waiting for a couple more people to join is you will have a chat button at the bottom of your screen. If you could go ahead and introduce yourselves so we can hear where you're from, and your role, the organization you're working at, that would be really helpful, just so we know who's in the room. We're really excited to welcome you from all over. And so we're going to be inviting you to, in the chat, introduce yourselves. Give us a brief greeting, where you're from, your name, what organization you want to, you're associated, if you're associated with an organization. If you're not, that's okay too. If you just came to learn, we're happy with that as well. But you're so welcome this morning, and we are going to get started in just a moment. One of the things we want to remind you of is you do have a mute button. We're expecting several people. We already have several people on the line today, so we want to make sure that we can hear each other. So if you're not speaking, please put yourself on mute. That would be really helpful. We have the chat function. We also have the ability to ask questions in the chat. So we'll prompt you for those questions, but feel free at any time. We are monitoring the chat. If you have a question, if you have a comment, if you have a thought, please be willing and able to share that with us. We also have captions. So if you would like to have closed captioning so you can both hear and see what's happening, you can enable that at the bottom of your screen. There should be a little button that says CC for closed captioning. On mine, I have to press more to get that CC, but once I press that, I can see the more. So if you want to go ahead and enable your closed captioning, that is helpful as well. Thank you, everybody. I see some folks from Long Beach. I see some folks from Colorado. I see, where is these folks from? Oh, good, LA, APLA in the house, welcome. Oh, I see some folks from Pittsburgh, welcome. And if I didn't get to you, it's not because I don't love you. My screen's just going, my chat's just blowing up, y'all. My plat's just blowing up. So keep those introductions going. We're really happy to have you here. As we move into some more introduction, we just want to honor and pay tribute to the folks who were the first stewards of this land, the Native American communities. We sit on the Ohlone people's land, and we want to make sure that we have a collective respect, that we understand that we are here to restore and promote the well-being of Native people who have had their land removed from them. And we are holding that space for this community that we are coming from, which is the Bay Area in San Francisco and Oakland. But we encourage you to think about the land that you are coming from and the people who are originally there. We also, as we began to acknowledge World AIDS Day was December 1st, and we want to take a moment to acknowledge the folks who have lost their lives throughout the HIV and AIDS epidemic, and also to acknowledge the legacy that they have left, and the forward movement that we have been able to make and the progress we have been able to make in HIV along the 40 years that HIV has been around. So we're going to take a moment of reflection, silence. Feel free to turn off your camera for that or leave it on, however you'd like to do it. And we're just going to take a moment. So I invite you to do that as well. Because that brings up a lot of memories for me, the folks that I've lost along the way, the people that I knew. But it also brings me a lot of joy to think about them and to think about what they would think about where we are now. I know they couldn't even imagine it, and I'm so happy to be in this space now. So thank you for doing that. We're going to continue on and just tell you a little about who we are and how we're coming to this space. So my name again, for folks who are just joining, is Jadon Wright Morgan. I'm the Deputy Director of the Collaborative, and we have 3 programs that we steward. Our program, the Pacific AIDS Education Training Center, we train healthcare providers, and we've been around for about 35 years. The AATCs, it's a national program, so if you haven't heard of the AATC, there is an AATC in your area. We're from the Pacific. We cover Arizona, Nevada, California, Hawaii, and the US, and the Pacific Islands in the U that are associated with the United States. But the program really supports providers with tailored technical assistance.
Jadon, I think you cut out there.
Might have some Zoom issues here. So yeah, Jadon just dropped off. So Pascal, I can take it from here.
Hello.
Oh.
Am I back? Can y'all hear me again?
You're back. You're back.
All right. Thank you so much. Sorry. I'm not sure what happened, but I came back strong, so that's okay. And I was just running through some of the programs that we have. We also work with Medicaid providers in California through our training development unit that works for providers in that program. And then the program that we are here today and focused on is our Care and Wellbeing Center. And that program really works with providers in the HIV and aging space. We work with folks who are, providers who are working at the cross section of HIV and aging. And that includes social service providers, healthcare providers, and also folks who are working squarely in the aging space. So we're really excited about all 3 programs and supporting providers through training, technical assistance, and capacity building in those programs. So our team, I would be remiss if I didn't acknowledge our fabulous team that has really worked hard to put this showcase together. I want to give them a round of applause, especially our program manager, our fearless leader, JB Del Razio. You've probably received several emails around the showcase from him, and also Constance Vasquez, who is our coordinator. They have done tremendous work to bring today's session to you all, and we are really excited. Our other team members, of course, have contributed, but those are the 2 that I want to highlight today. So thank you so much, JB and Constance, for all of your work. We're really excited to have this showcase come off so well, like I know it will be. So thank you. So a little bit more about the Care and Wellbeing Center. We are a Gilead Age Positively grantee, and we work with the other grantees in the Western region. We are really excited about the work that we have been able to accomplish over the last 3 years, including 20 live training sessions, We've also done 33 community development sessions, and that means that we're really working with community members, and we have a CAB who JB will talk about a little bit later, who also really influences those community development sessions. We also hold a conference called the CCC HIV conference. And through that conference, we were able to have 42 sessions. We've had the conference twice, and it's really been a great success. And we have been able to establish over the last 3 years, 122 partnerships. And when I see it like that, you know, these are relationships that we've built with folks over the years that have really helped us maintain the work, but also bring new people into the field of talking about HIV, and HIV providers who have really been able to learn more about aging services. So this is some of the work that we wanted to highlight in this moment, and we'll tell you a little bit more about the work that we have done, because it's really important as we move through this program. We're going to talk about the grantees that we have worked with and all of the work they have done. So we'll be sharing that with you. And hopefully you can glean from that some of the best practices that are out there that folks have really been doing. So as we think about World AIDS Day, we wanted to acknowledge that there are two major themes, one from UNAIDS, and it's called Taking the Rights Path. And it really is a focus on protecting human rights as a way of really supporting the HIV response. One of the things we know about HIV and the progress that we made is that it hasn't been even across gender, race, sexuality, economic standing, and that we really want to take a human rights stance so that we can address the needs of all the people who can be at risk for HIV and acquire HIV. So when I think about this, it's really comprehensive. What we're trying to do is really look at people in their whole selves. Culturally tailored to me really means that we're looking at people and all the identities they hold and welcoming them to the healthcare space, no matter how they're showing up. And that means that we're really going to be patient-centered. So being patient-centered, being person-centered means that we're really trying to meet them where they're at, to provide them with the services that they need to manage their health care and have the health outcomes that they want to have. And so I think this is a really important HIV, our World AIDS Day theme, and we're happy to support that through the work that we do and through the work of all of our grantees. Just want to tell you a little bit more about, promoting a rights and health equity approach. It's something that the collaborative, it's one of our values. And you'll see here the socio-ecological model. Many of you might remember that from some of the schooling that you've done, but you know, we're trainers, so we love a model. And I think this model really helps us understand that we're working at multiple levels at the same time, right? And so the work that we're doing requires us to think about all the things that really matter, right? It matters our political environment. It matters world events. You know, those things influence us. When we move to our organizations, how our organizations show up, the local work that's done is important to how our clients are able to access care. We also think about socioeconomic status, experiences, family status, citizenship. All of those things really influence the work that we do. They're the external things that people can see about us that sometimes influence the healthcare that we can access. And that all, leads up to how we show up in the world personally. So we are all rooted in an intersectional and patient-centered approach and principles, and we're going to be sharing more about how we do that work throughout this showcase. And part of really promoting rights in comprehensive well-being means that we're meeting the needs of people. And not all of us have the same needs, but I think we're showing you another chart because we're trainers. We like to make sure you have a visual. And a Maslow's hierarchy of needs really shows, what are our needs and how really to reach self-actualization takes a lot of different steps, right? That's at the top. But some of those basic needs at the bottom are basic physiological needs. Some of our programs are working at that level. Safety and security is very important, both psychological and physical safety. When we think about relationships and love, especially for older folks, that's something that, as you move throughout your life, your friends might change and there might be less family involved. And so creating spaces where belonging and love can really be felt becomes important for us to think about as healthcare providers. And then self-esteem, having value that you add to the world is really something that many folks really still need at all stages of life. And we hope that everybody can reach that self-actualization where they feel like they're reaching their full potential. And as I think folks age and really think back through their lives, they're looking for how they can contribute, how they have contributed over the years, and that looks different for different people. So we just want to acknowledge that journey and how folks are showing up in our different spaces. And as we talk about the different programs that we're going to be showcasing today, I think you'll recognize a lot of the needs that will have been met through the different services that have been provided. So we also have, because, we live in the United States, a World AIDS Day United States theme, collective action, sustaining and accelerating HIV progress. And we really wanted to highlight, in the domestic program, that we're going to be really looking at how we collaborate together. Collective action to me means that we are working together and maybe a little bit out of the box. We're used to working in medical spaces, but also the community engagement part is very important. Our communities are out there and they need the information, and sometimes they're not connected to healthcare organizations. So how can we be creative and creating a larger collective than maybe we even thought about before? Also, that goes along with service implementation and thinking about how we can address some of the disparities that we were talking about earlier in our human rights response. So we really want to think about how the programs that we'll be showcasing really show some of the ways that folks have been able to collaborate and to reach different aspects of these programs and bring people together in a more inclusive and holistic way to improve healthcare outcomes. So if you want more information about commemorating World AIDS Day and some of the resources out there, we have put together a page which you can pull out your cell phone now, take a picture of this QR code. We will also send out this information. I believe we're putting a link in the chat as well. But we have a World AIDS Day report and some supporting materials from HIV.gov. We also have some provider tools that can be helpful in moving your HIV program forward. And then some of the programs that are presenting today, the Age Positively Gilead grantees, we have those posters available online as well. So if you want more information, please access this website. It has all of the information that you're going to be looking for. So as we get started, we want to introduce the Director of Corporate Social Responsibility at Gilead, who is really the project officer for all of us in the Age Positively grants. and also a good friend of the program. Just always has really been a listener and an advocate for HIV and aging in this program. And so it's my great pleasure to introduce Darwin Thompson to really give us some opening remarks. Welcome, Darwin.
Hello, thanks, Jadon, for setting the stage and for your remarks. It's just remarkable to see the work that is happening. And so I won't be before you long because I think it's more important to hear from the partners who are showcasing, but I did want to just say a couple things and turn it back over to you guys. So one, I would just want to thank UCSF for bringing everyone together today for this important conversation, really to talk about aging, something everyone does, and most of us strive to do it gracefully, but often society does not always take this seriously as a public health issue. When we think about HIV, there's a reason why we rarely talk about aging. For a long time, an HIV diagnosis was considered a death sentence, and people did not think growing old while living with HIV is possible. Today, that's changed, and HIV is now a chronic disease, and we should all be proud and grateful for the HIV treatment and scientific advancements that make this possible. But with that change comes other challenges that we urgently need to tackle, and we know it will take a more than medicine approach to holistically support those aging with HIV over 50. So when we think about aging, 2019 was the first year in which almost half of people living with HIV were over the age of 50. And by 2030, as many as 70% of the people are estimated to be living with HIV over 50 in the US. And I know I'm preaching to the choir here, but when we think about aging, it's a unique experience, one which the HIV community faces without precedent. People aging with HIV are more susceptible to age-related illnesses, and by 2030, it's estimated that as many as 80% of people living with HIV will face at least one age-related medical condition, compared to just 29% in 2010. Additionally, older people living with HIV are more likely to experience isolation and loneliness, and are more likely to live alone. This is, in fact, the reason we launched HIV/AIDS Positivity in 2019. Through the help of a diverse advisory board that includes physicians, researchers, community leaders, and older people living with HIV to inform this program, Gilead AIDS Positivity Initiative has supported over 42 organizations, providing almost $36 million since its inception. And we are pleased that we'll be announcing another $10 million commitment to organizations focused on HIV and aging within the next 2 weeks. And these programs are helping to coordinate healthcare, reduce social isolation, and are working to address policy issues such as including aging people living with HIV as a priority population in the reauthorization of the Older Americans Act. And I'm also pleased to announce, and I'm sure Terry Wilder is on this call, but some progress that has been made in removing the upper age limit for the testing guidelines. And I don't have all the information because Terry is the champion there, but understanding that the guidelines were 13 to 64, and now there's in a comment period, but there's recommendations to remove the upper age limit and testing be based on physician or individual's preference. And so I'm really excited about the work that our partners are doing. But lastly, we must not forget about providing culturally appropriate HIV prevention education and awareness for individuals over 50. According to the CDC, 1 in 6 new diagnoses since 2017 were for individuals 50 and older. And so I'm really excited to hear from the partners on the ground who are doing this work and who are making an impact every day for older adults. And so on behalf of Gilead Sciences, we are grateful for your partnership. We're grateful for your work and ensuring that everyone can have improved health and wellness regardless of their age or socioeconomic background. So thank you.
Thank you so much, Darwin, and we couldn't do this work without you. This is really important to have Gilead behind us, putting money back into the community and really supporting this initiative. So we thank you and thank you for your remarks and reminding us of how important it is to really acknowledge folks aging with HIV as an important group who some people didn't think we would have this issue. And I'm so glad that we do. And that we're able to support folks as they age with HIV. So thank you, Darwin. We are also going to hear some opening remarks from Linda Scruggs, who is the co-executive director of Ribbon and the Age
Great. I think
Grant. Thank you, Linda.
great. Thank you, Jenna. Good afternoon or good morning, everyone. I am Linda H. Scruggs. I am here located near Washington, D.C., where I said afternoon. Ribbon is a center of excellence located right near outside of Washington, D.C. And we are here nationally providing HIV-related and health disparity education and training to diverse communities across the country. Ribbon is the organizing center for Gilead's HIV Aging Initiative. Since our conception, Vanessa Johnson, my co-executive director, myself, both are Black women living with HIV, creating a space where we're really working and concerned about the issues around HIV and chronic diseases as a whole, as they impact us very personally, but also the community that we're very committed to. Ribbon, we continue as a national partner in this initiative to partner first with community. As we're partnering with community, we're able to take those messages to policymakers, other national organizations, networks, individuals, and mostly to the HIV Aging Positively Coalition network that we're working with under the Gilead umbrella. We're also working globally over the last few months, talking to and taking the work that we're doing globally to other decision makers, and how do we mirror or we set new standards from the work that we're doing here in the US. For those of you who don't know Ribbon, let me give you a little bit more background from us. Our mission very simply is to promote health and equity by championing the rights of marginalized communities impacted by HIV and other chronic disease. We do that, just as I've been noting, by providing consultation, training, technical assistance to health and human service organizations, networks, individuals affected by and impacted by chronic disease and chronic conditions. HIV is our standalone priority area of disease focus. Our vision is to end racial, social, and environmental disparities that deprive vulnerable communities like the one we live in personally, and from their health and wealth by applying an intersectional racial and social justice lens to this work. Over the past 3 years, as the organizing center of Gilead's HIV Aging Initiative, we call it the Rock for Aging Organizing Center. We have been able to do a lot of work as we've been working with, as Jadon noted, 23 other funded HIV aging organizations, really focused at multiple places in the sectors of changing, impacting, and creating education and opportunities, as well as policy initiatives. Even as Darwin just noted, we had a great win this week, as CDC has noted that they are reviewing and they're in the final decisions in allowing the age limit around HIV and aging to be unlimited, because we believe that everyone should have that relationship with their provider. We're excited to be able to report that over our initiative, we've been able to, in addition to our technical assistance, been able to reach and create partnerships and collaborations with over 10,000 organizations and individuals. Collectively, as an initiative, we've reached over 40,000 individuals across the country in this work itself. Just to highlight a couple of things in my last couple of minutes, and then I have a charge as us as an aging group. You know, the Ribbon, our organizing center, we have a national action board of 20 members, 18 of which are people living with HIV, really grounding our organization in the MPact principles of ensuring that we're at the table. Ribbon has had the opportunity to do several multi-day convenings under this initiative, like the collaborative, we host monthly and bi-monthly different types of webinars and technical assistance. If you visit our website, we actually have, I think, 3 happening next week. Again, collaborating and building opportunities for hand-on and practical opportunities for both providers as well as community and organizations and networks itself. I really want to spend my last couple minutes extending on some work that we did and we started, and some of you may have been part of our 2023 when Ribbon, along with the People Living with HIV Caucus, hosted and convened the 40th commemoration of the Denver Principles. During that convening was a landmark opportunity, but some very important work was done during that convening with our policy action group. We actually created an executive summary brief around aging for our congressional leaders. We've been able to hand take that and deliver it to several of our congressional leaders and partners, and not traditional partners congressionally over the last year and a half. In this time where we're changing and we're partnering with new congressional leaders that they're coming in, and you're partnering doing the same as some of your state levels. I'll drop in the chat a link to that document so you'll have it directly. But we really will ask you to look at that document as we continue here at Ribbon to use our practices where we intersect and engage all individuals who are interested and uninterested of the important role of HIV and aging, and that we will move forward our policy agendas to ensure that both at all levels, at local, state, and nationally, individuals have the tools that they need. And we have to do that collectively to make decisions, provide resources, and to serve our communities properly. In the document that I'll share with you, we're really charging organizations to continue to train not just their staff, but also their community, your constituents around aging and all those things that intersect with it, both positive and negative. As you know, aging itself has a lot of stigmas and it has a lot of challenges. When we add HIV, we add them as well. We really charge those of us who are advocates and leaders in the HIV community to be informed, create alliances and partnerships on how do we continue, and we do not settle to go back or backwards. This is a time to move collective as part of the theme for the World AIDS Day, collective energy. We want to move collective power forward in our ongoing partnerships. We want to endure the rights and the tools and everything that the aging population need, and we'll only do that if we're together. And my very last thought, I want to really encourage you as you continue work with the collaborative, work with one another to really create a shared goal and a shared tomorrow. HIV will come to an end, but even at the end of new cases, those of us that are living with HIV and the organizations serving us will need to continue to do and work in great partnerships. Jadon and the team, I want to thank you for allowing us to share this morning. Thank you.
Thank you so much, Linda, for your remarks. I think there has been so many great programs that you all have been able to put together and to showcase. So we thank you for your efforts and your work. I'm going to keep us moving forward. We have one more opening statement from Andrea Callow, who is the Office of Policy Analysis and Development at the Administration of Community Living. Thank you, Andrea.
Great, thank you so much. And I guess first, thank you to the Training and Health Equity Collaborative for inviting me to speak today, and for Gilead's Age Positively initiative for their support and the wonderful work being done by all their grantees. You know, the partners on the ground really help us at the federal level make good policy and implement good policy, and we could not do it without you. So it is an honor to be here with you to commemorate World AIDS Day. I'm Andrea Callow. I'm the Senior Advisor for HIV Policy at the Administration for Community Living, or ACL, in the U.S. Department of Health and Human Services. ACL supports older adults and people with disabilities of all ages through programming and policy and research and advocacy. Folks may not be familiar with ACL, with our acronym, but I bet you know some of our programs, those authorized particularly under the Older Americans Act. We fund the senior centers in your neighborhood, home-delivered meals through service providers like Meals on Wheels. We have job training programs, caregiver assistance programs like support groups and respite care, transportation, exercise and wellness classes, your Tai Chi classes and bingo size, as well as information and referral for long-term care, advocates and nursing home facilities, and many more. It's really a comprehensive bevy of programs that we offer. So everyone over the age of 60 is eligible for Older Americans Act programs, but we know the need for these programs is not shared equally. So the Older Americans Act has always, since it was signed by President Johnson in 1965, prioritized populations in greatest economic and greatest social needs. So that's in the law that Congress passed. And it lifts up low-income older adults, racial and ethnic minorities, individuals living in rural areas, those with limited English proficiency, and older adults at risk of institutional care and isolation. And this year, for the first time in nearly 40 years, we updated the regulations implementing the Older Americans Act statute. So the regulations that my agency promulgates that kind of get deeper and more detailed into how that federal law should be implemented. And in those regulations, we specifically identified older adults living with HIV as a population in greatest social need. This is the first time people living with HIV, to my knowledge, have ever been identified specifically by any of the laws that the Administration for Community Living administers, which is a huge victory, I think. So as a result, the Aging Network will work to ensure they understand the needs of older adults in their states and localities, that they are effectively outreaching to these populations and serving these communities in comprehensive, culturally tailored and person-centered ways to echo what we heard earlier. This is what we're looking for from our grantees. So I would really encourage everyone listening to familiarize themselves with the Aging Network and the services they provide. I did see one of our Aging Network providers. I won't call her out, but I'm very happy that she's on the line. So familiarize yourself with the network and with the program at the state and local level. We're going to pop how you can find that in the chat, the elder care locator, which I'll come back to. First, so you can access services for yourselves, for your clients, for the people you love, but also to be advocates and experts to assist us in implementing these final rules. So your expertise is invaluable, and federal law is requiring our grantees to look at their programs and find ways to improve their services for older adults with HIV. So if you go to the elder care locator, which they put in the chat, it will direct you to enter your zip code or your city, and you can find the planning bodies, to use an HIV word, but it's sort of similar in the Older Americans Act. The planning bodies, the area agencies on aging, the state units on aging. It can also help you find services in your neighborhood. If you're a mom or your grandma or you need transportation, you can go to the elder care locator and find that. ACL also works in partnership across the federal government with diverse national and state stakeholders on initiatives to improve the lives of older adults living with HIV. And in 2023, we worked with the Assistant Secretary for Health's office, with Admiral Levine's office, on a rural and urban HIV and aging challenge. And we gave away $1 million to 20 community-based organizations for their innovative ideas. And there were winners across the country in rural and urban areas. We had them in San Francisco and in Newark and Detroit, in rural Colorado and Georgia, in Navajo Nation in Arizona. And we had a few of our winners present their progress at the Ryan White Conference in August. So I will put that recording in the chat for you as well if you want to learn more about our winners. There's sort of a showcase. It's really awesome to see what they did. And I'll say these federal challenges are a really fantastic way to get funding out quickly to the organizations in the field and on the ground who are rooted in their communities, who know what needs doing and how to do it. The federal grant process can maybe sometimes be a little cumbersome, a little complicated. You need an expert to do it. The challenge had a really low barrier to entry, so we could get in applicants who maybe wouldn't normally apply for a federal grant, but could apply for the challenge. So finally, I'll just say how much we appreciate the collaboration with the HIV service providers, advocates, researchers, people with lived experience, the whole community. And I would really invite and encourage you to engage with aging services in your area. My experience is that our aging services network wants to do this work with the HIV community. They want to partner, but they sometimes don't know where to start, and they need an introduction. So we've already gotten a lot done. Oh, and I will say, I'm going to put my email in the chat. If you are sort of confused by the aging network, or you're new to the space, or you just like to bounce a few ideas off me, please contact me personally, and I would be happy to kind of map things out with you on a one-on-one basis. So I'll just close by saying we've already gotten so much done together in the past couple of years. I remember when the last HIV strategy was released on World AIDS Day in 2022, and it's so incredible to see that progress report that's come out and all the work that's been done, particularly for folks aging with HIV. And I do have every confidence that we'll continue to work together, that we'll continue pushing forward, and that the progress can and will continue. So thanks again, and I look forward to hearing the rest of our presenters.
Thank you so much, Andrea. It's so important. The links that you dropped in the chat are great resources. I've looked at them myself, even for my own personal aging folks that I help to support. And it's really just a great service. And we appreciate your comments and for you being present today. I am now going to hand it over to JB Del Razio, who is the Caring and Wellbeing Center Program Manager, to just tell you a little bit more about our program and some of the work we've done and how we really centered the voices of people aging with HIV in the work and also health equity. So thank you, JB, for your comments.
Thank you, everyone. And thank you to Darwin, Linda, and Andrea, and thank you, Jadon, for passing off the torch. And it is not really needed for me to repeat all of these statistics that I feel like us in the HIV sphere have been hearing for many, many years. But for those of you who are new to the HIV and aging service space, these are just some numbers that really signify the depth and need for programs like these that will be shown in the showcase. And despite advances in HIV prevention and treatment, HIV stigma remains a significant barrier to care engagement and retention. So our work really focuses on ridding service systems of stigma, including racism, sexism, ageism, homophobia, and more. And we do that through our capacity building and training efforts, like Jadon mentioned, and we really integrate community, service innovation, and system coordination, ensuring that aging communities are not left behind, and our sample capacity building efforts are here. And our community advisory board provides firsthand insight to service priorities and really guides how our 3 provider training activities are conducted and what the priorities are. And this is our community advisory board here. They brought significant experience to the board and really utilized their experience and voices to make sure that our trainings were relevant, practical, and impactful. And this slide really shows how we conducted our community advisory board. And throughout their 3-year tenure, they've shared their stories with our HIV and Aging Conference, facilitated various trainings, and several of them are advancing into roles at the local, state, and federal level to really bring up more of the intersecting experiences around HIV and aging. So I really want to commend them as well. And this is some of our training data, which really exhibits the impact of our interdisciplinary training model and what kinds of learners attend our trainings. These trainings aim to increase quality and capacity of services for people living with HIV over 50 and leverage the strengths of all service providers, including case managers, physicians, nurses, and caregivers. And many of you all have attended our previous trainings, so thank you once again. And our work really aims to break those silos and barriers. And to do that, we take special attention to make sure that everyone has something new when they attend our trainings. This slide shows our broad reach and how our peer-to-peer training model can facilitate learning across state borders. And to finish very briefly, I want to make sure that we drop our tools, templates, and resource banks that we created at the Care and Wellbeing Center to really help implement, sustain, and accelerate the progress in HIV and aging services. We'll be dropping this link in the chat, and without further ado, let's get started with the showcase. First of all, chat questions are encouraged. Presenters are going to be available to address them throughout the showcase, and live Q&A will be conducted at the end as time allows. These presentations will be a 5-minute taste of what these teams have to offer, and we'll be sharing their full posters and presentations after the showcase as well. And first up in our showcase is Rhea Van Brockland from Christie's Place, so take it away.
Good morning, everyone. My name is Rhea Van Brockland, and I'm the Executive Director of Christie's Place in San Diego, California. I'm here today to share our work around women aging with HIV, and around 65% of the clients that we work with are over the age of 50. Next slide, please. So here in this picture is Christie Milton Torres and her husband Angel and her son Christopher. In the 1980s, most of the services for people living with HIV were focused on the needs of gay men. And Christie really became an advocate for services that would meet her unique circumstances as a young mother diagnosed with HIV, with a child who was born HIV negative. When she passed away in '94, her adopted mother, Irene Milton, continued her legacy and founded Christie's Place in 1996. And we're really the definition of a grassroots community-based organization. We believe that the work doesn't exist unless it's first viewed through the many different lenses of the communities we serve. So we believe in gathering feedback and listening to advice from the community through every step of program development, from concept to implementation to evaluation to adaptation. And finally, our mission is to empower women, children, families, and individuals to take charge of their health and wellness. Next slide, please. We can bundle our services in 4 different buckets, with the first being our clinical services that includes case management, mental health, and peer navigation. Our second bucket contains our essential supportive services, where we provide support groups, psychosocial groups, food and hygiene needs, and family events, childcare and transportation. We also do in our third bucket, the empowerment and leadership development services. So this is where we bring together groups of women living with HIV through our annual conference, our peer navigation trainings, our women's retreat and Healing Hope storytelling project. And finally, we do capacity building services, because the way that we do work at Christie's Place is really different from many other agencies in San Diego. And our trauma-informed approach exists at the root of the agency. So now we're sharing these practices with others so that they can better serve women living with HIV. Next slide, please. So this is our house at Christie's Place. For many of our clients, Christie's Place is their second home. This is the only place where a lot of them feel they can fully be themselves. Therefore, we honor everyone's privacy and understand the existence of HIV stigma. So when we're beginning to think about incorporating aging support services in our programming, we knew that it needed to be different. And we knew we would be better suited to build off of our strengths, which is really the heart and trauma-informed nature of Christie's Place. Next slide, please. We named our aging program 50 and Beyond, or FAB for short. It addresses 3 different components, which is to increase engagement and retention in systems of care, and also decrease isolation for women aging with HIV through community building, relationship strengthening, and leadership development. And finally, to decrease internalized and perceived stigma by amplifying the voices of women aging with HIV through story collection. Next slide, please. Our first goal for FAB was to build off of our best practice program, peer navigation, and expand it to engage women aging with HIV. This goal really focused on increasing mental health support and activities and educating our HIV service providers on how to deliver trauma-informed services to women aging with HIV. And peer navigation has really served as the foundation for a lot of our programming since it was introduced in 2010, well before it became a national best practice. Our peers are at the heart of the agency. They're the women who inspire and motivate and move the community community into action. And they not only link women aging with HIV to life-saving services, but they also help to create support networks where they feel empowered to grow and learn and come into themselves in ways they may never have thought possible. Next slide, please. Our second goal with FAB includes strategies to build community and leadership through important relationships. So we offer support groups for women aging with HIV through leadership development and connection. We engage community partners and advocates through our annual information sharing conference focused on aging issues. And then we also celebrate the families of those aging with HIV through monthly workshops, quarterly family events, and other opportunities that support not just the health wellness, but also the mental health. Next slide, please. And for our storytelling piece, storytelling is often the first way that two people connect. They look for a commonality and share their experiences to learn more about one another. And it's really that first step in advocacy. And people often misconstrue advocacy as being loud or being really difficult and intimidating. But in reality, it starts with a person's story. Our Healing Hope Storytelling Project captured the journeys of women aging with HIV, and we collected these stories and turned them into our first book, Healing Hope, A Woven Tapestry of Strength and Solace, and use this to really do outreach to others and engage partners in doing work with women aging with HIV. Next slide. Finally, we wanted to highlight some of our accomplishments to date with our FAB program. We've engaged and trained 47 women aging with HIV as peer navigators to help connect women to care. We've reached 396 women aging with HIV through community building and wellness activities. We've provided 874 hours of mental health therapy, stigma reduction, and isolation reduction activities. And of those participants, 95% have initiated and retained HIV care, and they've reached viral suppression. 5 of our peer interns were mentored, and they're now doing the work in the community and getting paid for their experience. And finally, releasing our Healing Hope book was such a highlight, and we celebrated with so many community stakeholders and clients and presented at national conferences. So finally, in the next slide, we have a lot of goals to build off of our FAB program, and we really look forward to continuing this impactful work in the community and really advocate for the necessity of small CBOs as having a continued place and priority at the funding table. Finally, here's my contact information, and thanks for allowing me to speak about our program.
Thank you so much, Maria. And can I get a Zoom round of applause for our first presenter? And I will keep us moving and bring up Troy Preble, who is going to be presenting on aging well at Cascade AIDS Project. So all yours, Troy.
Hi, welcome to Aging Well, a program of Cascade AIDS Project of Portland, Oregon and Southwest Washington. If you'd like to learn more about our program outside of this presentation, you may visit agingwellnw.org. There will be an opportunity at the end of this presentation to take a screenshot. Okay, who we are. Well, we have myself, Troy Preble, the manager of Aging Well programming. I am a long-term survivor, and I was thrilled to be chosen for this role. Next, we have Bauer Luna, our program assistant. Then we have Derek Webster, our program coordinator, and we have Brian Reeves, our program specialist. Brian is funded through a grant by Cambia Health Foundation to teach technology training and internet safety to aging adults with HIV. Our mission. At Aging Well, our focus is older adults aging with HIV. And we support these folks so they can embrace life after the AIDS era through well-being and community building. And all of this improves health outcomes. In addition, we offer what cannot be bought, and that is family and purpose. Next slide. Our 5 pillars. Our program planning, activities, community engagement efforts are guided by 5 pillars. These pillars form the foundation of our comprehensive approach, which addresses a wide range of needs and amplifies voices to foster more inclusive communities and services. Integrating community. Now, we offer multiple feedback mechanisms to gauge our program's performance and identify areas in need of improvement. This process requires building community trust and individual humility. Peer leadership has been crucial in understanding the community and its diverse needs. What we do, as you can see, our activities are quite wide-ranging. These activities stem directly from our community engagement efforts. We leverage internal and external partnerships to deliver a wide range of programs. For instance, we have a lunch and learn and a dinner and learn. Those are all opportunities for participants to learn more out of the medical field from doctors and other medical experts. And our World AIDS Day event that we just had honors long-term survivors by sharing their stories of survival and resilience. And that created a memorable experience for the public, the general public, and ensures those stories are preserved, which is important. Now, all of our diverse activities are born out of peer leadership. And personally, I share my story as a long-term survivor to support individuals struggling with PTSD from the AIDS era. Some call it AIDS survivor syndrome. If I can recover, so can others. And I believe my story uplifts those that are still struggling. By the numbers, calendar year 2024, so far this year, we've had 3,550 attendees at our events. We've been in contact for individual support with 450 people. And we've had 208 individual contacts to volunteer for community. So these numbers are almost double of 2023, which is a huge increase. And our numbers, I think, prove the value of centering community voices. I recommend paying attention to your attendance and any feedback you get from the community. For an example, our coffee social at first was a monthly event and attendance was really strong. So we went to bi-weekly and attendance stayed strong. So I wanted a coffee social, a sober event on parity with our weekly happy hour. So we went to a weekly coffee and attendance is still strong. So clearly there was a need for more frequent sober events. So what I recommend is that you think about the events you offer or that you may offer and ask yourself, are you meeting the participant needs? Community impact. Now, the quotes above demonstrate our effect on the community. We cherish the work we do because we know that it does matter. And Brett said, what I get most from Aging Well is socialization, education, purpose, and family. Jean, I would be isolating more if I did not have the friends I made at Aging Well. And Mike, I cherish the support of the community we've built at Aging Well. And moving beyond the AIDS era, what you can learn from our program is that life is possible after the AIDS era. Engage your clients, stay flexible to their needs, and your program will grow as a result of that. Older adults living with HIV want the same things you do, community, safety, joy, and purpose. So it's up to us to determine how we achieve those. Thank you very much for listening and learning more about our Aging Well program. And again, here's an opportunity to take a screenshot if you'd like. agingwellnw.org, great information on our website, and you can contact me personally at tpreble@capnorthwest.org. Thank you very much.
Perfect. Thank you, Troy. And thank you for all the amazing work that you're doing up in Portland, Oregon. And I'm going to pass it on over to our team members over at the Shanti project here in San Francisco. So take it away.
Thanks, JB. Hi, everyone. My name is Liz Stum, and I am the HIV Programs Director at the Shanti Project.
And I'm Eric Sutter. I'm the Senior Director of Programs at Shanti.
And we're really proud to be presenting on the successes of our Finally Age project, which was made possible from Gilead over the last 3 years of this grant cycle. And a little bit about us. Shanti is a nonprofit. We're located in San Francisco, and 2024 is actually our 50th anniversary providing compassionate care and reducing isolation amongst the communities that we serve. And our Finally Age project really just expands on our existing services supporting aging folks living with HIV and is really focused on improving the health, well-being, and quality of life of this growing population. And really at our core, Shanti is about building meaningful relationships. And we feel like these relationships are really essential for improving the overall health outcomes for aging people living with HIV. And next slide. And then within Shanti's HIV services, our program provides one-on-one care navigation. We do emotional and practical support, advocacy for our clients. We also do medical case management to assist people at risk of falling out of medical care. We have our peer support volunteer program, which matches volunteers to aging folks who provide social support and some light practical support. And then all of our staff and volunteers go through this really comprehensive 24-hour training to make sure that people who are doing this work are prepared to do this work with our clients. And then with our focus on social connection, along with our one-on-one support, we have a ton of groups focused on HIV and aging, as well as larger community events such as quarterly disco dance parties, and we have annual overnight retreats. Next slide. But what really makes Shanti unique in the system of care is our service model. So we provide non-judgmental, client-led, and harm reduction-based services to our clients. And our services are also mobile. So our team is meeting our clients at their homes and out in the community. And this is really what sets us apart from, traditional case management services. And with our goal of reducing isolation amongst this population, we definitely had a lot of lessons learned coming out of the COVID-19 pandemic and how we tailor our services to meet the needs of our aging clients. We found that providing multiple pathways, such as individual, small group, and community events, both online and in person, really led to an increase in social engagement. So really what it comes down to is meeting people where they're at and acknowledging that not all spaces are comfortable for all people. So this tailored approach and providing as many different safe spaces as possible for older adults to socialize has been really successful for our program. I'm going to pass it to Eric.
Thanks, Liz. Excuse me, Shanti utilizes a harm reduction and trauma-informed active listening model known as the Shanti model of peer support that is centered around 3 key tenets: listening from the heart, speaking from the heart, and acting from the heart in service to another person. Shanti model is a non-directional model and focused on establishing trust and mutual respect with each person we have the privilege of serving. We work alongside our clients with the goal of establishing an authentic connection with them, which enables us to best understand how they define health and wellness and work with them to ensure that they're thriving. A unique aspect of Shanti's service model, as mentioned by Liz, is our leveraging of volunteers from the community. This really helps us expand our reach really significantly. Shanti volunteers attend a weekend-long training focused on our model of peer support and are then placed in a match with a client overseen by a Shanti care navigator for additional support. Volunteers commit to providing a few hours of practical and emotional support weekly for a minimum of 6 months. Our matches typically last an average of 2 years. We train folks quarterly and currently have over 100 client and volunteer matches. Next slide, please. Over the grant period, we saw significant increases in each of the service modalities funded by Gilead's Age Positively grant, which include nurse case management, care navigation, and volunteer support. We attribute this to many factors, with the most significant including our clients' needs for more comprehensive support to help them age in place, being connected with more clients with complex service needs, especially triply diagnosed folks, and maintaining productive connections to other providers within San Francisco's continuum of care for people living with HIV. Next slide, please. Right. Here you can see that over the 3-year grant period, we had an 86% increase in volunteer support and a 25% increase in viral suppression with our. Got a quote here from one of our folks that I'll read. "I am beginning to feel isolated as I age with HIV, and Shanti activities have really helped me with services and given me a reason to socialize. Next slide. All right. We love talking about our work, so please get in touch with us. We're always happy to answer questions or provide any support we can to help replicate programs in other places. Thank you so much for your time. Thanks to JB and the team, and thanks to Gilead.
Perfect. Thank you, Liz and Eric from the Shanti project here in San Francisco. And to keep us moving with the showcase, I'm going to pass it off to B at the Translatina Coalition. So thank you so much and take it away.
Awesome. Hi, everyone. My name is B. Curiel. I serve as the Capacity Building and Trainings Program Manager at the Translatina Coalition. And I'll be presenting a little bit about our Center of Excellence for Elderly Trans program, talking about the intersections of aging and HIV in the trans, gender expansive, and intersex community. So a little bit of what we're going to talk about. No, we don't have a lot of time here, but we're going to talk a little bit about the work we do as the Translatina Coalition, a little bit about the community and the intersections of aging and HIV within the TGI community, the disproportionate impact, and as well as our Center of Excellence for Elderly Trans program and a group that we call the Diamonds. And I'd like to think we have a Q&A section. We might not get to it. So I encourage you to put your comments, questions in the chat, and I'll leave my email for y'all to also contact me. I want us first to get us grounded in a short little video snippet of our community. I always like to bring in the voices and the faces of the communities that we serve. A lot of folks who don't often get to talk at spaces like this. So I'm going to get us off started with the short little video. Thank you. So as mentioned, that is our Trans Latina community over here. We're based in Los Angeles and do statewide advocacy work. So the mission of the Trans Latina Coalition is to advocate for the specific needs of our Trans Latina community that resides in the USA and to plan strategies ultimately that improve our quality of life. We do offer a plethora of programs, anything from housing to reentry, to HIV testing and prevention. We also have often do community engagement activities. We have train the trainer programs. I personally oversee the training department and go out to do trainings to different organizations and really help build the capacity to be able to serve our community. So today we're going to be highlighting specifically one of the programs that we have called Center of Excellence for Elderly Trans. And so we can go ahead and move forward with discussing that. So like I mentioned, we focus on the TGI community, and TGI stands for transgender, gender expansive, and intersex community. And so the intersectionality that we see really here is at the intersections of being trans. Also, a lot of our folks are BIPOC, so Black, Indigenous, people of color. A lot of folks are Latinx, come with an immigration background. And so with those intersections, HIV and aging creates a unique set of challenges. We think of things like language access, sometimes the lack of knowing what institutions are able to do for TGI folks who are aging in HIV. So the intersectionality can sometimes complicate disproportionate health outcomes that are already there. Our community faces high rates of systemic barriers, stigma, discrimination, and oftentimes see exacerbated challenges that create compounded vulnerabilities. So in conversations about TGI community, sometimes we often see that our community faces a disproportionate life expectancy. Our community faces a lot of violence. And what we really see with our aging population is a generation that was often neglected in the efforts to try to provide health equity. So a lot of our community of older adults living with HIV lived through an era where they were not necessarily integrated and included into the fabric of institutions. So oftentimes they are not aware of where they what services are accessible and available for them, because there is a history of trans folks not being included into things like shelters, public services, health, and different institutions across the board. Next slide. And so we do see, like I mentioned, a disproportionate impact on health disparities. We see sometimes a big lack of culturally competent and affirming services when it comes to healthcare, as well as different social services. Language access is a big thing in our community that we often try to support our community with. And trans folks often face insurance coverage issues due to sometimes insurance coding on the basis of gender and sex. And so, coding on the basis of sex assigned at birth instead of gender identity. And so in our community, we also see high rates of social isolation and loneliness, a lack of family support due to rejection. And so as folks age, these things become exacerbated and can propose significant barriers for folks. Next slide. And so we really try to take a resiliency approach to the services that we provide. Our diamonds come with so much experience, so many different stories that often don't get to be talked about in these spaces and beyond. And so we really try to empower our community. And part of that is involving our aging population, that, you know, this group of trans women that we call the diamonds, into policy advocacy and empowerment through being able to speak at things like public comment and stuff like that. So our Center of Excellence for Elderly Trans program offers comprehensive case management and is really meant to be a full service dedicated program to support these folks through things like going to their appointments, making sure that they're connected to different financial benefits. A big barrier in the community is a lack of financial safety net. And so, you know, we do our best to try to give the Diamonds and other folks in this program the opportunities to be able to go to workshops, be able to be part of focus groups that have stipends, and involve them in the community in a way that gives back, in a way that helps them advocate for their own needs. And so I encourage you all to learn more about our program through looking at our poster. Here we have added a QR code to the report that we did with this group of our community members from the Center of Excellence of Elderly Trans. And so I know that this QR code is also on our poster, so I recommend checking it out. And so for the next slide, we have a call to action. So what can you do to continue support our community? Like I mentioned, our TGI community members, especially those aging and living with HIV, often don't get brought to the conversations that really matter and really have an impact on their lives. So I encourage you to really, you know, in conversations and thinking about aging population, trying to spread awareness, trying to really make sure and ensure that there are opportunities for TGI folks to be in those conversations, in those spaces, is really important. And so supporting trans, not just LGBTQ organizations, but really ones that are focused on these vulnerable communities within that umbrella, supporting trans-led and trans-focused organizations that really do the work to try to grow different parts of institutions to be able to include and integrate us into the fabric. And so I have connected here our policy agenda, where you can read more about the work that we're doing and more about the advocacy efforts that we have. And I think that's, you can learn more about our organizations at translatincoalition.org. Again, my name is B. Curiel. I serve as a training programs manager. I have my email here. Please reach out if you have any questions or like to talk more about the work that we do at the Trans-Latino Coalition.
Good. Thank you, B. Can I get a round of applause for the Trans-Latino Coalition and all the great work that they do to make sure that our trans siblings and elders are integrated and protected in this world. And to keep us moving on, I'll pass the mic over to Jeff Bailey from the APLA Health to talk about their Hive program. So take it away, Jeff.
Good morning, everyone, or good afternoon. Thank you so much for joining us today. My name is Jeff Bailey. I'm the Director of HIV Access here at APLA Health. And thank you, JB's team, for switching out my slides there because there was a kind of a major faux pas there. So next slide, please. So many of you may know us as AIDS Project Los Angeles, but back in 2014, actually 2013, we transitioned to become a federally qualified health center, similar to our friends over at the LA LGBT Center, who I see is here as well. And I oversee the division that I always tell people, which is formerly AIDS Project Los Angeles. So I oversee all the programs that support low-income persons living with HIV. And I don't have it here, but the mission of APLA Health is to restore dignity and trust within underserved communities by providing world-class LGBTQ+ empowering healthcare, HIV specialty care, food, housing, and other essential support services. Next slide, please. So back in 2017, we did a study which led to the formation of Hive, and specific to this Gilead grant, because Hive is a little bit broader, but specific to this initiative, I oversee the project along with Brian Risley, the program manager, Tevin Henley, who's a clinical case manager, which was a new component for this initiative within the framework, and Emmanuel Sanchez Ramos, the program coordinator. Next slide. So Hive is standing for HIV Elders, is a program for gay and bisexual men and other men who have sex with men that are 50 years of age and older. Our population primarily reflects the epidemic of Los Angeles, where the plurality of participants are Latino, African American, white, and API. So the components for this particular initiative is clinical case management. I know you may say case management is not necessarily a novel approach. However, we incorporated this because given the history of APLA being a support service organization and transitioning to primary medical care, and being in various sites throughout LA County, they're very siloed services, and there wasn't a lot of collaboration and connection to support services. So the role of Tevin really has been to be that connection and that liaison between the primary clinical staff and the support services that the older patients may need, and particularly our Olympic clinic, where Dr. Michael Gottlieb practiced for many years, and he retired almost 1 year ago. Positive self-management, you may be familiar with that. It was initially developed at Stanford University. It is now an evidence-based practice for chronic diseases. We implemented it initially 2 years ago, but we found that the 6 sessions were far too long. So we engaged Patrick Piper from the California Prevention Training Center. We pared it down to 4 sessions. The clients love it. And we are going to offer a Positive Self-Management 2.0 in 2025. We also shared from the senior literature what's called as shared interest groups, because our clients told us they did not, and this is their language, want to attend any more whiny support groups. So we took this from the literature, and we meet in Starbucks, other coffee shops, other locations, and the clients, they just talk about what they want to talk about, or the participants, they get to generate the conversation. So given in LA and near the, entertainment industry, often, around February, March, it's about what movie did you see this year? What are the Oscars? Things of that nature. So really, it is what's going on that they want to talk about. Mindfulness, we work with Dr. Matt Silverstein, who's a mindfulness expert at UCLA. And it's an extension of positive self-management where we offer a 4-session mindfulness workshop. And then finally, what we really started with Hive back in 2018 was really social networking events. They go on like a harbor cruise at Valentine's Day. They go to movies. They go to bowling. They've been to, you know, the LA Chargers games, Clippers games. It's the Pantages Theater. So it's really about getting that social connectedness today. And what we found it is really a good funnel and a recruitment for the other interventions. Next slide. So what we have learned over the past couple of years with regards to Hive, one is that it now has expanded. There is a monolingual component, which Emmanuel generates for Spanish-speaking older men. We also have expanded it to include women as well, because we've always had a number of women participants, but now we have some women's focus programming. But social events. So we believe that the use of social networking not only serves as a tool to reduce social isolation, but it's a great entry point for other intervention activities and for their participants to build trust. Group level interventions, the scheduling and frequency of these is really critical. The time of the day, a lot of our clients don't want to travel in the evening. Women prefer to have events that are kind of between the time they may drop off their children or their grandchildren and the time that they need to pick them up from school. Also, the number of sessions in a lot of the evidence-based interventions are quite long. There's numerous interventions, and so that can have some group level or intervention fatigue. So finding ways to pare that down and adapt them and break it up is also very helpful. And then the personal connection, and particularly because of what we went through a few years ago with COVID, maintaining connection with clients, particularly through virtual activities, but also through phone calls, checking in with them, text messaging, meeting with them one-on-one. We have food pantries throughout LA County, so it's easy for us to interact with our clients quite regularly. So it really establishes a good relationship and once again, trust with our clients. On the right-hand side, you can see a typical calendar. I know it's kind of hard to read. There's a lot going on there, but this is our December calendar. We probably generate about 30 different types of activities a month, whether they're virtual activities or in-person activities, or they're activities that are a collaboration with other things that are going on in the community. Next slide. Finally, I apologize if I race through this. This is our contact information. Please feel free if you have any questions about our program framework, our model, and so on and so forth. We'd be happy to share that with you. You probably have heard about us through some of the conferences that JB and his team have facilitated and hosted. But thank you all very much, and I hope you all have a great holiday. Thank you.
Thank you so much, Jeff. And I do want to highlight that Andrea dropped an updated positive self-management program in the chat. So hot off the presses, and thank you for sharing how y'all conduct the Hive program. Up next, I'll pass it over to Arya Shabazpur-Shabazi to talk about the research that has been done at MPact.
Hello, everyone. Hello, I don't know if you can hear me. Perfect. I'm going to jump in directly. It's from a project called Outlast Project, and we name it Our Voices, Our Lives. This project is conducted by Dr. Gottfried Shanti and in collaboration with MPact and Thrive SS in Atlanta. Next slide, please. So who we are, my name is Arya Shabazpur-Shabazi. I know the last name is a little bit tricky. I'm the Community Mobilization Coordinator at MPact Global Action. We are a global organization advancing the health and human rights of the gay folks around the world. We partner directly with advocates around the world to ensure our community has the resources they need to effectively demand support and advocate for themselves. We work to educate via campaigns and activities to raise awareness, share up-to-date information, and empower the community to mobilize, change policies, and shift cultures. You can see some of our core programs. So what did we do? The purpose of our research was to support aging Black gay men living with HIV to understand their struggles. And usually when we try to understand the struggles of the underrepresented community, who's better to ask than the community themselves? So that's why we decided to go down the road with CBPR, and that stands for Community-Based Participatory Research. For those who are not familiar with it, it's the type of research that emphasizes on collaboration, respect, and shared decision-making with the community. And this method ensures that the participants are centered to the research, and by engaging them not only as the subject of the research, but also as co-researchers, we value their experience and their insight in shaping the direction of the study. So through this approach, we fostered first trust, and then relevance, and then cultural sensitivity, which is ensuring that their voices and their experiences are represented in our findings. Next slide, please. So usually, these communities are not represented correctly, and we have some of the findings. I'm going to share some statistics here, but if you'd like to look at the statistics that we find, you can refer to the poster. 90% of the participants reported to have financial barriers to their HIV medications. 80% highlighted stigma as the persistent challenge affecting their personal relationship and healthcare experience and doctor-patient communications. All participants noted that the compounding effect of racism and HIV stigma is leading to increased isolation and health disparities. And 100% of the participants highlighted the crucial role of the community organizations in providing the vital resources that they need. And it's important to highlight that this is often because the community has already exhausted all of their options, since they don't really fit the general criteria of other programs or services. And as a result, these organizations are the last resort that's left for them. So let's slide, please. We have a few lessons that we learned from this this research, and I want to go back to the CBPR, the community-based participant research. When we talk about the CBPR, there are different degrees to which the participants are usually involved in this type of research, but we decided to go down with every step of the way to ask them and to counsel them for forming the questions and finding the solutions, which actually helped us to understand the community's needs better, to respect and understand the way that they would like to be approached and have these often difficult conversations around the topics. And so as a result, we gained valuable insight that might have been overlooked without having them involved. Aging is a component that is not on its own maybe a deciding factor, but when combined with other issues, it turns into a unique problem to this community. For example, in addressing mental health, financial struggles, or isolation, we see that the long-term impact of trauma from losing loved ones during the early days of the epidemic, and the burden of enduring HIV-related medical expenses over time has the effect of self-shame that comes from being disconnected from their families, from their church, or a few factors playing a very important role to actually understand the current state of things. So these findings are applicable to other groups or communities as well, particularly those who are experiencing and HIV-related challenges. I can give you an example of the programs that we have. It's called Vida Positiva, and the program is specifically created to respond to the needs of HIV-positive gay men, to have a community which aims to reduce isolation and stigma. This program has been implemented in few cities in Mexico, Argentina, and Brazil. And this year, we are excited to announce that we're coming to the US. If you'd like to join the movement, I kept it very short. If you'd like to learn more about the work we do, explore possibilities and collaboration, how you can join our movement, I left my email here, and you can visit our website. Yeah, and thank you very much for listening to me. Back to JB.
Okay, thank you, Aria, and thank you for all of the amazing community-based research that y'all have been doing in collaboration with Thrive SS. And again, that bringing up the collaboration aspect throughout this showcase. And up next is going to be Michael McFadden over at the Los Angeles LGBT Center. And take it away, Michael.
Thank you so much. Great to see everybody. My name is Michael McFadden. I'm the assistant director at the LA LGBT Center in the senior center, senior division. We provide comprehensive services for older adults 50 and over. We operate 2 very large senior housing facilities, 100 units, approximately 100 units each within the neighborhood. We provide comprehensive support groups for folks living with HIV, both in English and in Spanish. Additionally, we do some more kind of targeted mental health support with monthly dinners, grief and loss groups, and topic-based discussions, particularly around grief and loss around the holidays. We really take the public health interventions and opportunities very seriously, particularly offering COVID information sessions and COVID vaccinations, along with other vaccinations as well. We offer a primary, we are an FQHC, offer primary care and research opportunities as well. We serve daily lunch each day to our seniors, as well as nutritional workshops, food pantry, and farmers market. We really want to address the folks' basic needs, so we have free showers and laundry available Monday through Friday, and physical health workshops throughout the month. We offer case management, employment assistance, and housing navigation. Housing is one of the strongest needs and requests that we have, particularly when we're living in Los Angeles. Cost of living continues to increase disproportionately for our folks. We're sex positive. We want to make sure that folks are having fun, having sex, and doing so in healthy ways. We really want to focus on end-of-life planning and making sure that folks have the resources and support to be able to address end-of-life needs, particularly with sometimes limited supports. We have 10 locations throughout the Los Angeles area. One of the things that we've really tried to focus on in the last few years is making sure that the service that we're providing is accessible in the communities where folks live, as opposed to having to travel far distances in order to come to access services. And wanting to make sure that it's being done in culturally appropriate and culturally inclusive ways. Which also includes addressing kind of racial and class dynamics throughout our programming as well. One of the interesting and strong components of our program is the opportunity to collaborate with our youth services program, offering intergenerational opportunities for conversations across ages, and a strong advocacy and policy advocacy component, including our Senior Advocacy Academy and opportunities for lobbying days in Sacramento. The main thing that I wanted to share today is just recognizing that the population that we're working with has been engaged in social services for a long period of time, and it's imperative that we not only engage folks in getting their feedback, but making sure that we hold that with direct responsibility to provide the services to them, and that we have an uphill battle knowing that folks have been asked their opinion over and over and over again, but maybe not received the care that they need. And so we're just really holding that with a deep level of responsibility as service providers. Basic needs are still important, particularly as folks age. The cost of living, specifically in Los Angeles, continues to go up at a disproportionate rate to the increases in income, particularly for folks on fixed income. So the provision of basic health needs is really important. And the advocacy, giving folks an opportunity, as many folks that on this call have shared earlier, giving folks a space to be able to share their voice and make sure that they're heard, and often for folks in communities that may not be heard traditionally. The one thing that came through for us when we initially did our focus groups, was that some of our populations had different expressed needs, and this is a gross exaggeration, but for a lot of our white folks, they were saying that they wanted to come together and talk about anything but HIV. That they felt really confident in the management of their HIV, but they were looking for more opportunities to connect and socialize. For some of our Black participants, They shared that they wanted to come together, not only just folks that were infected with HIV, but impacted by HIV, and really bridging those gaps across serostatus, and really wanted to access services within their own communities. Again, not having to travel to to Hollywood in order to engage in care. For some of our Asian API identified folks, there was just a strong feedback around being included and being recognized. That oftentimes, given the smaller numbers of folks living with HIV who are AAPI, they're often not included in a lot of our programming directives. And then last but not least, some of our Latino folks shared that access is different. And that where some of our white folks said that they feel really confident and comfortable around the management of their HIV care. For some of our folks with language and access barriers around immigration status, that the support network for them was not as connected in the same ways that we would want and hope for other folks. So the last piece I wanted to share is just recognizing that as HIV organizations, and specifically many of these organizations are led by folks with disproportionate amounts of privilege, that impacts the way in which we engage in work as well. And so making sure that we are doing community repair work, specifically with the clients that we serve, but also our fellow organizations across the city and across the country. There's historically, I think, been a focus on being the biggest and the best and the first. And what I think right now is really important, especially given limited resources and changing landscape, is really about coming together as a community and sharing resources and making sure that the safety network is intact for our communities. So just want to say thank you to Gilead and to JB and for the opportunity. Here's my contact information, and looking forward to chatting further. Thanks.
Okay. Thank you, Michael, for bridging together both the advocacy aspects and the community or provision aspects of your HIV/AIDS positively initiative program. And to finish us out, I'm going to pass it off to Paul Aguilar over at the San Francisco AIDS Foundation. So go ahead and finish this out, Paul.
No pressure. Good morning, afternoon, everyone. Thanks for being here. Thank you, JB. All these fabulous presentations, faces I haven't seen since San Diego. Good to see you all again. My name is Paul Aguilar. I'm the long-term survivor community liaison at Aging Services at the San Francisco AIDS Foundation, where we focus on building a fulfilling aging experience for people living with HIV, using social connection to foster good health and well-being, particularly within our priority communities, which are long-term survivors and communities of color. Next slide. Thanks to the generous funding, we've significantly expanded our reach. In between 2020 and 2024, we've essentially doubled our events and increased our client base, maintaining growth. As you can see, despite some challenges in 2023, we had some staff turnover, and we relocated our offices near the end of the year last year. So some of our client interactions had gone down, but we're bouncing back with this new year. Our client demographics, which are shown on the right, you see the age range of our clients. We don't card people. People are self-identified, but you can see it does spread quite along from age 40 up to 80. Our client San Francisco is also communities of color are impacted in San Francisco as well. As you can see, 70% of our clientele or our membership are white, and a third are communities of color. Next slide. So this is the result. What you're seeing here are the results of a survey of 50 Bay Area service providers. It's very text intensive and a lot of information, but what I want to bring out is the top 3 issues that came up during the survey, which in this very expensive area to live is housing, of course, deeply affordable housing. Studies have already shown that those who are stably housed experience a higher rates of viral suppression, leading to, healthier health outcomes. The second issue that has come up with this is, oh, I'm sorry, I just lost my notes. I hate when that happens. Okay, let me try again, I'm sorry. The challenges that are faced by them are housing, that's right, and the need to collaborate among other HIV service providers and aging providers. We also need to address the systemic inequities that impact women and the communities of color. The need for social connection is also something that's come up for long-term survivors who have experienced significant loss, and the need to collaborate among HIV and aging service providers to make sure that there's cultural competency when interacting with our clientele. Next slide. The power of connection. At San Francisco AIDS Foundation Aging Services, we recognize that social connection is vital for health and longevity. In providing opportunities for social engagement, we empower our clients to build supportive networks, combat isolation, and to thrive. Our program offers diverse activities from support groups, social gatherings, to workshops and outings, and designed all to foster belonging. Our director, Vince Chrysostomo, often asks clients and staff, what is the world you wish to age into, and how can we assist you in creating this world? This embodies our commitment to centering client voices. Our guiding principle, nothing about us without us. It underscores our dedication to working alongside our communities to ensure that their needs shape our programs. Our aging service department actually grew out of our 50+ support network, which was basically coffee socials every week. And what grew out of that was our aging services, because our clients, as others have said earlier, nobody wants to go to a support group, but they'll come to a coffee, and that actually turns into its own support group. It's the best part of the work that I love. And that's it. Back to you, JB.
Perfect. Thank you, Paul. And really emphasizing that last question of what is the world you want to age in and how can we create it? So as we finish out this showcase, asking ourselves, asking our clients, asking our community that question, what is the world you want to age in and how can we build it? And with that, I would like to just have one more Zoom round of applause for all of our speakers. All of y'all had amazing presentations and significantly impactful work. And I know that your communities deeply appreciate all that you do. And now we want to hear from the attendees today. So what were some of your aha moments throughout the presentations? Like, were there particular programming ideas? What are some pieces that you're going to be taking away with you in your work? Feel free to come off mute, drop them in the chat, and let us know what you have coming up after this showcase. Feel free to raise your Zoom hand, do all of the features. Okay. And then I see Shakina.
Thank you, JB. I really loved how this presentation highlighted truly to the core of peer support, as well as meeting people where they're at, whatever that looks like. And so all of the organizations showed how to do that. Thank you so much.
Absolutely. And we really want to make sure that meaningful involvement of people living with HIV and AIDS, that principle stays true in both HIV services and aging services. So thank you. And do we have one more aha moment from the audience, from our team members, from our presenters even? Paul, see your hand raised, go right ahead.
So I put it in the chat. I was surprised and yet not surprised to see the common threads of the programming throughout all of the agencies that presented. I mean, very similar strategies to help increase health outcomes, healthier outcomes, and to engage clients in meaningful activities. I mean, there's a commonality and yet there's still their individuality because of the different communities that they each serve.
Yeah, exactly. So I want, in connection to that, I want to pull out what Troy mentioned during his presentation as well. Older adults living with HIV want the same things that we do, including community, joy, love, and purpose. But it's exactly how do we achieve that and how do we understand the needs of the community in order to build these programs, in order to build this programming. So thank you everyone for your participation in this showcase, and to continue on the work in our in improving outcomes for people living with HIV and aging with HIV. We have all of our care and wellbeing center materials available here, including our recorded trainings, our tools, our newsletter sign up, so you can make sure that you stay up to date on all of the upcoming happenings that we do have. And lastly, we do have one more training for the year next Thursday, December 12th, 10 a.m. to 12 p.m. So make sure you access that World AIDS Day commemoration post, because registration and more details about the session will be available there as well. Lastly, I want to share our session evaluation. As we brought together all of these wonderful presentations, we want to know, what did you particularly enjoy? How can we improve? And make sure that our free HIV and aging training capacity building activities can be the best that they can be, so we can support you and so you can support your communities. So please take a second out of your Friday to complete our session evaluation. The link is going to be dropped in the chat and we'll be emailing it out as well. And again, we want to make sure that you access the posters that are going to be distributed. And thank you for attending our program showcase in commemoration of World AIDS Day. And with that, I would like to release y'all for this wonderful.
Just one more thing, JB. Since we have a few more minutes, I just want to really let you all know that next week's final learning collaborative is going to be on creating community partnerships. And I think as you all were talking today, many of the community partnerships that you highlighted are so important. And thinking outside the box, this is going to focus on an aging center who really developed a lot of community partnerships that were non-traditional and also included HIV and AIDS. So I know that, you have a lot of learning opportunities. There's a lot of webinars. There's lots of things to do. But I just really want to highlight that topic, because I saw that come out in the presentations today as well as a theme, is how important it is to think outside the box and to partner with different folks, to also hear from your community, what are the things they're struggling with. You may not know those folks, but as we build relationships across different sectors, different types of organizations, that's where we can also answer some of those unanswered questions for our clients. So that is the session next week. JB, can you tell them what the date is?
Yeah, it's December 12th, 10 a.m. to 12 p.m. Pacific. And I'll also drop the registration link in the chat as well.
Awesome. Thank you so much. Because I think that's going to be a really great session to close out our learning collaboratives for the year. I also just wanted to extend my thanks to you all for staying the course, staying with us throughout these presentations. Everybody did such a great job. We are really excited to have you all be able to share with us what has happened over the 3 years and all of the successes and some of the challenges and solutions that you all came up with. The adaptations, I think, are important just as much as the plans, right? We write a great plan, but then we change the plan because the people tell us we need to. And so you all did that. And I think that's really important for us to acknowledge and to highlight. So thank you again, everyone, for attending the session. The recording will also be available on the website. So for those who are not able to attend, your colleagues, other organizations that you think would benefit from this, please let them know that this recording is available. And also the posters that each organization created really highlight what are the main points that you can grab. They're easy to access and easy to read. And so I also wanted to just highlight that as a way of us being able to share information with each other, because it is about collaboration. It is about making sure that we're responsive. And sometimes we don't know everything and we can learn from each other. So thank you so much for providing that learning for us today. And now, JB, if there's anything else that you would like to add, please complete the evaluation, and we will see you hopefully next week for that final learning collaborative.
Absolutely. Just dropping the evaluation one more time in the chat, and we will be emailing out all of these resources. So again, thank you so much for attending this session. Enjoy the rest of your Friday and have a restful weekend, everyone. Take good care.